Hello, and welcome to the Grace Episcopal Day School 2019-2020 Open Enrollment presentation. Your open enrollment will begin on January 28th and run through February 1st. So you have through Monday to Friday to make your elections. This year we're welcoming 27 member institutions to our 17th annual IQA Open Enrollment. We're excited to welcome you to this process, and we hope you find it simple and easy. IQA is tackling the biggest challenges. We want you to access the best health and well-being benefits at the right time, the right place. We want you to get engaged to improve your health and well-being. We want you to have access to the highest quality care for the lowest cost possible to improve your health and well-being outcomes.
So IQA is a self-funded plan. And as a self-funded plan, that means IQA pays all claims processed by medical, pharmacy, behavioral health benefit managers from premiums collected and from reserves built up over the years. IQA takes those premium dollars saved for the exclusive benefit of our members, and we only spend premium dollars on benefits for our members. This plan is unique. It's created specifically by educators for educators, and we invest in a long-term culture of well-being so you can be the best version of yourself. And so how do we work to keep the plan costs as low as possible? Well, we do this by establishing some programs and efficiencies to help us mitigate those claims. So a few of those programs, we have the Blue Distinct Total Care Providers. Anytime you visit one of those providers, it's a $0 copayment. There's also a $5 copayment for your teledoc visits. We have low prescription drug copay structures, and we encourage everyone to get their biometric screenings so they know where their numbers are. We also have case management and care consultants. So if you get a call from any of these care consultants or managers, feel free to answer those calls. Their main objective is to assist you through the difficult situations you may encounter. We also have the IQA Cares Pharmacist Advocate Program, along with Teledoc, Rally, and then you have your resources for living benefits. And new this year, there's Surgery Plus that we'll talk about in a bit. Okay, and what can you all do to help the plan? So one of the ways you can do this is by being a smart consumer. You take advantage of your free preventative care services. You can register for Teledoc in preparation for maybe a sore throat or a sinus infection. Call IQA Cares to see if they can help you lower your prescription costs. We also have 6 free EAP sessions where you can meet with a counselor and get some advice, whether it's with something with mental health, finances, adult care. There's many different ways and options to get those 6 free visits. You can visit a dermatologist and get your preventative skin cancer screening. There's also on the Blue Cross and Blue Shield website, there are pricing tools to help you shop for the best price for advanced imaging and other services. And then you can join the Rally City Challenges and sync them with your device for a chance to win $50. So it's really in your hands. We encourage you to get engaged and use your IQA benefits.
So how does the IQA plan stack up against all those other people out there? We heard from the annual survey feedback that your main concern was the cost of benefits. In this comparison, you'll see the average employee-only cost. In this, we've determined that our group is slightly older, we cover less families, and Florida is more expensive for health care than the average nationwide industry. We also offer richer benefits. So even with all of these odds against us, we're below the education industry at $12,200 and everybody else at over $13,000. IQA's average is coming in at just over $10,000. Another way to look at our benchmarking versus other PPO plans out there. Because of IQA's innovative approach, our rates and premium cost is coming in 17% below the national database benchmark average and 22% below the education industry benchmark average. So what are we going to talk about through the rest of this presentation? We're going to touch on enrollment and eligibility, some of the perks that are offered through IQBA, and our 2019 benefit plans shown here.
Let's see. Okay, so we can start off by talking about how you can enroll in your benefits. You can do that by going to icubabenefits.org. During your open enrollment period, you'll be free to update your benefits for the 2019-2020 plan year. Those benefit elections that you make during open enrollment will remain in effect until the plan year ends. You may change your elections during the plan year only if you have a qualified life event. So make sure you choose wisely. How do you get started? When you go to the IQBA benefits portal, you'll see a button that says Start Your Enrollment, and you'll click on that from the homepage. Ask Emma. As you're going through your enrollment, you may have some questions regarding which plan is right for you. We do have the Ask Emma feature. She is a decision support tool, and she can help you make smart, cost-effective decisions to fit your individual and family's needs.
So who's eligible for the IQBA plans? Your legally recognized spouse, a natural child, a legally adopted child, stepchild, a child with a qualified medical child support order, anybody that you have legal guardianship over that resides with you, and a foster child. IQBA's plans also cover dependent children up to the end of the calendar year in which they turn age 26. We know everybody reads the fine print before you submit your enrollment, but just in case you missed this paragraph, you are certifying that all the dependents enrolled in your IQBA benefits are in fact yours.
We also have an open enrollment sweepstakes again this year. When you log in to icubabenefits.org, you can update and confirm your personal phone number or personal email address. Once you finalize your enrollment, there will be a little box that asks you if you agree that this information is accurate and up to date. And when you click agree and you finalize your enrollment, you are magically entered into our sweepstakes. So make sure that you pay attention and get yourself enrolled. If you have an update to, say, your address, that's when you'll have to go to your Human Resources office and have them updated there for you. Also, we have single sign-on features for you. Depending on which plans you are enrolled in, there'll be a section under My Carrier Accounts that will have links to our brand partner portals. You can check out your claims history, order new cards. There'll be some information and features, some discounts there available for you as well. So we do suggest that you go and just look around and check out each of those portals.
So what are the medical plans perks that are offered with your IQBA benefits? New this year, we're going to cover Surgery Plus and benefits that are in existence already, but we just want to remind you of our Teladoc, IQBA Cares, and Blue Rewards. Surgery Plus is the exciting new benefit that we're happy to announce this year. This plan will supplement your medical benefits offered through IQBA. So when you elect the medical benefits, you're automatically enrolled in the Surgery Plus benefit. Surgery Plus has a special network of surgeons of excellence. These network participants are licensed, board certified, they've completed a fellowship, and they have the lowest complication rates. Surgery Plus covers hundreds of medically necessary, non-emergent, plan-based surgeries, including the ones listed here. Again, these are non-emergent. So if you need emergency surgery, please consult a physician. With these non-emergent planned procedures, Surgery Plus offers a full concierge service to create a better member experience. When you contact Surgery Plus to discuss your non-emergent surgery, if you decide to go with their recommended facility and physician, they will waive your coinsurance and deductible, eliminating all of your out-of-pocket costs. The concierge service will handle all aspects of the scheduling, locating, and coordinating your visits and your surgery. They'll provide the top 3 surgeons that best fit your needs, and they'll organize it from start to finish. If you call on April 1st, the average time to the procedure is approximately 35 days. So if you're making plans to have surgery, this is a great option for you.
And again, this year we have Teladoc for you. Teladoc has really gotten some pretty great reviews this year. So if you haven't already, make sure that you go and register for Teladoc. You can do this by signing in from the My Health Toolkit, and that link is on the IQBA Benefits portal. Just remember, as we said, there's a $5 copay. You have access to physicians, qualified physicians who are contracted with Teladoc 24 hours a day, 365 days a week. When you are registering, please remember that your company ID is IQBA. The Teladoc benefit is meant to supplement your ongoing relationship with your primary care physician, and it really can be used as an alternative to urgent care for simple ailments, and we have some listed here: your sinus problems, pink eye, ear infections, UTIs. So please make sure you share your Teladoc records also with your primary care physician so they can have a full picture of your medical journey. And also we have the IQBA Cares Pharmacist Advocate Program. This is a great prescription drug resource. You can call them for a prescription drug checkup. They can review with you your current medications, discuss side effects, and make sure that your drug interactions are appropriate. You can also help you coordinate with your doctor and insurance company on things like prior authorizations, step therapy, quantity limits, and they can also help you in determining if you need a brand versus a non-brand drug.
All right, Blue Rewards powered by Rally. This is a snapshot of our 2019-2020 incentive plan. Not much has changed here, but we have added a few opportunities to earn some additional coins. This benefit is available to all covered employees and covered spouses of the IQBA medical plan. So get in there and get to earning your $250. One of the new programs that we added through Blue Rewards powered by Rally is Clinical Rewards. This program targets chronic conditions. So if you have one of the chronic conditions listed here, your Rally site might look a little different. The reason for these programs is to provide education to you. If you complete the requirements, the quarterly education requirements, you'll be rewarded 500 Rally coins each quarter or 2,000 Rally coins for the year. Requirements include reading and meeting with a health coach and stuff to get you on the right track. We're also continuing the city challenges and private sweepstakes. So we had a winner every 14 days in the current plan year, 2018, 2019. So in 2019, 2020, we're continuing the $50 Amazon incentives. So get in there, join the city challenges, and sync your device.
Okay, so now we'll move on to discussing our medical, prescription, and behavioral health plans. IQBA has strategically prepared for you the best-in-class benefits. Blue Cross and Blue Shield handles our medical. Optum Rx is our prescription drug carrier, and then we have Aetna for our behavioral health and EAP. Get the care you need. So here we just wanted to outline some of the services and where you go to get help. So if you maybe need your annual checkup, preventative care, your screenings, and just your ongoing medical care, you'd want to visit your primary care doctor. And we have down here listed below, if you see a Blue Distinction Care provider, that should always be a $0 copay. Otherwise, it's at 20% coinsurance. We have Teladoc, convenient care and urgent care facilities. Teladoc has a $5 copay. If you go to a convenient care center, maybe like a Walgreens Health Clinic or CVS Minute Clinic, that's a $10 copay. And urgent care is, of course, a $10 copay. We also have outlined here some of the medical conditions that you may want to consult Teladoc Walgreens, CVS, or an urgent care regarding. And then you also want to be mindful, there are some pop-up freestanding ER clinics that try very hard to mirror an urgent care. So just be careful as you're making that decision. We also have an emergency room benefit for you. There's a $300 copay for that. And of course, that's waived if you're admitted. And we also have some of the conditions and life-threatening health problems that you would consult the ER regarding. And then we discussed this briefly earlier, health management and care consultants. So of course, if you receive a call from them, they're calling because they care about you and they want you to be the best version of yourself. These are trained health advisors and registered nurses, and they're calling to provide you with some tools and education regarding your chronic health conditions, and they can also advocate in your behalf when it comes to providers and just getting you the right knowledge at the right time. They can assist you with setting, goals, help you better understand your treatment plan. They can support you with referrals. There's just a plethora of things they can assist you with. So just if you receive a call, make sure you answer. And of course, to piggyback on what we said earlier, that starts by making sure your phone number and email address is available.
All right. Also in the employee survey this year that we conducted a few months ago, customer service was a big ticket item for you guys. So Blue Cross Blue Shield has ramped up their customer service number with this enhanced program called Care Connected. This customer service is really technology driven. So they've provided us a very unique team that is trained in our benefits that can help answer your questions. And the technology behind it is if you call, it tracks your ID number and will route you to the same advocate if they're available. So you don't have to keep repeating your story and repeating your questions. They also have more in-depth look into your records and can help assist you more efficiently. It's the same service, or a brand new service with the same phone number that's found on the back of your ID card. Just as a reminder, primary care visits to Blue Distinction Total Care providers are always free. So that means medically necessary services performed in a family practice, internal medicine, or pediatric office with this designation are always free. So if you're in the market for a new provider, make sure you're looking for this Blue Distinction Total Care logo.
Okay, so we'll move on to your medical plan, and you all have the preferred PPO plan. There are a few changes this year. The deductible has increased by $500, as you can see here, and then the out-of-pocket has increased by $1,000. You still have the same in-network benefit of coinsurance for any specialist or your primary care at $20. We've discussed earlier your copay structure for Teladoc, convenient care, urgent care. We still have the free labs through Quest, free medically necessary labs through Quest, $0 preventative care. We have your $250 copay on your ambulance rides, and all your other fabulous benefits still remain in place.
Just to reiterate, the deductible for individual is going up by $500, as well as the out-of-pocket by $500 for individual, and the family deductible has gone up by $1,000.
Thank you, Rachel. Okay, so with that being said, knowledge is power. We have a plethora of benefits that are not subject to the deductible, and we've listed some of these here. So anytime you're getting advanced imaging, you're getting your annual checkup, you're going to see a specialist, maybe getting physical or occupational therapy. All of these benefits listed here are not subject to your deductible. So we still have some pretty great benefits for you guys. And then what also can be helpful is knowing what does apply to the deductible. So under the IQVIA plan, only your major services are going to apply to the deductible. And we, again, have some of those listed here. If you're admitted to the hospital, maybe you have to get some durable medical equipment like a CPAP. If you're doing some inpatient mental or substance abuse or getting an x-ray, all of these things here are subject to the deductible. So just make sure that you go to the Blue Cross Blue Shield system and shop before you go so that you can choose the provider or the facility that's going to be the most cost effective for you.
IQVIA's prescription drug plan is unchanged from last year. The one thing that I do want to call out for you again is that 90-day supply will save you money. We have 90-day supplies available via retail and mail order, so it's just the wise decision. You can pay a 1-month supply and pay your regular 30-day retail copay, or you can pay for a 2-month supply but get a 3-month supply in return. We also want to remind you about the prescription drug freebies. If you're on prescribed diabetic supplies or prescribed aspirin for adults, generic folic acid or prenatal vitamins, or if you qualify for those generic statins, those are all free under your prescription drug plan with Optum. Optum has also taken your customer service concerns into consideration, and they have made some improvements to their website. They implemented their new customer service team last year, so there wasn't much they could do there, but their new website is very innovative. You can set up your mail order, manage your prescriptions, find pharmacies. There's lots of stuff you can do in there, and they also have a mobile app if you would like to download that as well.
Okay, also available to you is the behavioral health and substance abuse benefits offered through Aetna. So this is bundled again with your medical plan, so there's no additional cost to you for that. And so you can get professional counseling, psychiatric medication evaluation. There's also some autism benefits available. And then if you need some intensive service like hospitalization, detox, or just to be in treatment as a residential facility, we have those benefits available to you. And just please be mindful that there are some benefits listed here, like maybe your autism spectrum benefits, and then your intensive services like inpatient hospitalization that do require, prior authorization. We also have the Able to Condition Management Program. This is a great free benefit that's been added on to the medical plan. So when you have a health or life condition which could benefit from a counselor's engagement, you can call Aetna and they can help you find out more about any eligible conditions and any other details about the program. I just would like to say that I have personally been through this program and I cannot say enough good things about it.
So partnering with the behavioral health, Aetna also provides our EAP to support your emotional well-being. So the same phone number applies for both plans, but option 1 will get you to the Employee Assistance Program. With the Employee Assistance Program, everybody is eligible for this benefit. You do not have to be enrolled in the IQVIA medical plan to reach the Employee Assistance Program. Everybody can call this phone number for free and confidential services and advice. You can seek help for emotional support, life, legal, or financial services. And I would encourage you to take advantage because there's 6 sessions per issue per year. So if your students are driving you crazy, that could be 6 sessions. And your spouse is driving you crazy, that's another 6 sessions. So make sure that you're taking advantage of this great free benefit. Resources for Living has also introduced a digital aspect or a digital way for you to connect with a therapist. If you're busy on the go, you don't have time to actually talk to somebody. Now you can actually message somebody through multimedia messaging, including text, audio, pictures, video. You can download the mobile app or you can contact them through a web browser. There is a slight delay in the response time. It's not like the instant gratification that you get with text messaging a friend, but they will respond within 1 working day. One thing to note is you must call Resources for Living for authorization before you actually download the app and step through this process, and you must be 18 or older to use this benefit. Here are your monthly plan premiums. This is your employee versus employer split.
Okay, so now we'll get into some voluntary benefits. We have IMED, who handles our vision benefits, and then our dental is through Humana benefits. And here is your IMED vision plans. We have the base plan and the buy-up plan available to you all. One difference I want to point out in the plans is your frame allowance. If you're on the base plan, then you're allowed frames once every 24 months versus the buy-up plan. It's available once every 12 months. You have your copay allowance on your contacts lenses. It's a $0 copay up to a $100 allowance. And then anything above that, you'll get a 15% discount. We have your copays listed here as well, so you may want to make note of that. Under the buy-up plan, we have a $0 copay with a $130 allowance, and then again, there's a 15% discount on anything above that $130. And here are your monthly vision premiums for the base and the buy-up plans. We also want to make note that there are some additional network benefits provided by IMED. There's a 40% discount on prescription eyeglasses. There's a 20% discount on non-prescription sunglasses. And then, of course, as we mentioned earlier, there's a discount on anything beyond what your plan covers.
So dental is next. If you love getting your teeth cleaned like I do, I would recommend the high option dental PPO plan. This provides 4 cleanings per year or 2 periodontal cleanings, which aren't as fun. With a plan year maximum of $2,000, and this benefit does cover orthodontics. Next in line, we have the Preventive Plus Low plan. The important thing for you to know about this plan is it's for preventive and basic services only. So if you happen to need a root canal this year, that service will not be covered by this plan. It is for preventive and basic services only. So this plan would cover like a cleaning, for instance. It has a plan year maximum of $1,000 and does not cover orthodontics. The DHMO is also available to you. This benefit is only available in the state of Florida. Another item to note is you must have a pre-selected dentist. If you are currently enrolled in the DHMO plan and do not have a card from Humana showing your pre-selected dentist, I would encourage you to call Humana and get established with the dentist in case you need to see them. The way that the DHMO works, it does not have a deductible, but it is based on a schedule of benefits. So this is just a small sample of benefits outlined here. It covers a full spectrum of all the dental services that you could think of, outlined in a detailed schedule of copays. And these are your dental plan premiums.
And then we also wanted to just provide you with an update and give you some information on the Affordable Care Act and how that works relates to IQVIA. So the preferred PPO plan is equivalent to a gold plan offered through the marketplace. IQVIA has lower out-of-pocket costs, a broader network of providers. Of course, the benefits are offered pre-tax, and then we have a more generous free wellness benefits. Also want to mention the 1095 tax forms. Those will be available to you shortly on the IQVIA benefits portal at IQVIAbenefits.org. That will be located in your employee file. You can keep this form with you when you're completing your tax returns. They're not required, but in case you need it for IRS auditing purposes, you'll have a copy of that return, and then it's always available online to you. And then any and all other requirements of healthcare reform are in place, so you can rest assured that we have your best interests in mind.
These are a few of our mobile apps. One to call out for you is the new Blue Cross Blue Shield app. This was released middle of the year last year, so you might not know it's available. But now you can get on your phone and download this app. It's really handy. You can check all of your benefits right from your phone, and it actually has your ID card right there in the app. So here's just a snapshot of all the benefits that we have offered to you on the go.
Oh, and lastly, we want to thank you for listening. Thank you for your attention. And on behalf of ICUBA, Rachel and I and the rest of the ICUBA staff wish you well in this upcoming plan year.